Hello, Miss Williams. How are you doing today?
I'm good. How are you?
Doing very well. My name is Adrienne Wright. I'm a pharmacist on duty. I see that you've got a new medication that you're picking up today. Excellent, excellent. Well, do you mind? Do you have a few minutes if I sit and talk to you about it, give you some information about it? Okay, yeah. Excellent. Real quick though, could you do me a big favor and confirm your date of birth?
It's 3/1/46.
3/1/46. Awesome. And can you tell me, are you taking any other prescriptions right now?
I'm taking pravastatin.
Pravastatin?
Yeah.
Okay, for your cholesterol?
Yeah, and then
Okay.
it's a really big word. It's like hydrochlor or something.
Hydrochlorothiazide?
Yeah.
Blood pressure pill?
Yes.
Yeah, gotcha. Excellent. And taking anything else right now? Okay. Are you taking anything over the counter? Any supplements or vitamins or anything like that?
I take Tylenol arthritis sometimes.
Tylenol? Okay. Anything else? Okay. And do you have any allergies?
No, I don't think I do.
Excellent. Well, like I said, you got new medication. You know about that. So what did your doctor tell you this medication was for?
It's for my osteoporosis.
Okay. Osteoporosis. Now, do you know what that means?
I know. I see stuff on TV about it all the time. That
Okay.
it's supposed to, the medicine's supposed to help me from breaking a bone.
Right.
Because when I'm old, my bones just want to break.
Well, over time, that's right. Yes, over time, your bones get very weak and kind of brittle, which makes them easier and more having more of a chance of breaking.
Okay.
So this Fosamax, which is also known as alendronate, is going to help prevent that and show you right here. This is what it looks like. Okay. So it is a 10 milligram tablet that you will be taking once every morning. Okay, you're going to be taking it by mouth with a full glass of water. Now, the thing about this, it's different from your other prescriptions. It's kind of unique in how you take it, okay? So when you get up first in the morning, the very first thing I want you to do is I want you to take this.
Okay.
You're not going to want to have anything on your stomach or have had anything to eat recently, so when you wake up in the morning, your stomach will be empty, okay? So you're going to want to take this first. And as soon as you take it, you're going to want to wait 30 minutes to an hour before you eat or drink anything other than water.
Okay.
You're also, you're also going to want to remain standing during that time. So either sitting up, standing, don't lay back down. It's very important to do that so that it works properly.
Okay.
Now, let's see. As far as taking it and storing it, very important to keep it in a dry place. You want to keep it out of direct sunlight. You want to keep it at room temperature, so don't leave it in your car. Don't put it in your bathroom where there can be moisture in the air. And you're also going to want to leave it or keep it out of the reach of children or pets. So any grandchildren you might have, any pets you might have, just make sure they can't get into it.
Okay.
Let's see. If you miss a dose, you're going to want to take the next dose. So say it's 12 o'clock, lunchtime, and you realize, oh no, I forgot to take my Fosamax. Go ahead, wait till tomorrow morning. Don't take it as soon as you remember it. Don't take it any later. Like I said, you want to have nothing in your stomach.
Okay.
So if you just forget about it, just wait and take your next dose the next day. Okay? Some common side effects you might have are you might have some headache. You might have some kind of mild muscle and joint pain. You might have a little bit of tummy pain, maybe some diarrhea. But if you have any chest pain, if you have any signs of having an allergic reaction where your skin's all red, you've got some swelling, or if the muscle and joint pain becomes very severe and hurts a whole lot, stop taking it, call your doctor immediately. That's not really anticipated. That's something we definitely don't want to happen. So make sure, call your doctor if anything like that happens, okay? Now, do you do any exercise or anything like that?
Not really.
Okay, well, something that might be kind of beneficial when you're doing that is to maybe like get up in the mornings or in the evenings, whenever is best, and maybe walk 10-15 minutes. It might also help to do like some light exercises with maybe a 1 or 2 pound weight. But if you don't feel like doing that, that's too much. Just like maybe get in a 10-15 minute walk. Okay? And let's see. You're also going to be taking calcium and vitamin D. Did your doctor tell you about that?
Kinda. He said, I remember him saying something about it, but he says a whole lot that I don't really understand that well. So.
Kind of talks over your head a little bit?
Yeah.
I understand. Well, do you know why you're going to be taking that?
No. I've always heard calcium's good for your bones, so I'm guessing that it's for that. So,
Right.
But how much would I need to take?
That's a very good question. I'm glad you asked. I actually, for a lady of your age, and considering that you are a woman, you're going to want to be taking a little bit more than most people, most men, that is. So you're going to be wanting to take 1,200 milligrams of calcium a day, and you're going to want to be taking 1,000 units of vitamin D. And I went ahead and took the liberty, because I knew you were coming in, to pick out a specific brand. It's called Puritan's Pride. Not that it matters, but the thing I liked about it is it's already got the 1,200 milligrams of the calcium and 1,000 units of the vitamin D. So you've only got to take one.
Okay.
Okay? So the best thing about this, the way I would take it is after you've already taken your Fosamax and you're getting ready to take breakfast, it's been 30 minutes to an hour since you've taken your Fosamax, go ahead and take this with breakfast. You want to take it with some food on your stomach. You want to make sure you take it while you're eating breakfast. And you might also, while you're taking it, you might have some constipation happen. But again, if you have any issues with any allergic reactions, then you're going to want to immediately stop taking it and call your doctor.
Okay.
And it's the same for storing it. You're just going to want to keep it dry place, out of the sun, away from moisture, room temperature, and keep out of children and pets, out of their reach. Okay? Now, real quickly, can you tell me how you're going to take these?
I'm going to take this one in the morning when I wake up.
Okay.
And I can't take it with food, so I've got to wait about 30 minutes or an hour.
Mm-hmm.
And then I have to take water with it.
Mm-hmm.
And sit upright.
Right. And if you miss a dose, what do you do?
I have to wait till the next day.
Right.
And then that one I can take every day with my breakfast or lunch.
Mm-hmm.
And if I miss a dose, I can just take it whenever I think about it.
You're right. I didn't tell you that, but yes, if you forget to take it, you can just take it whenever you want. So if it's lunch or dinner even, go ahead and take it. Okay? So what other questions do you have for me today?
I just want to know why I can't take the calcium and vitamin D instead of the Fosamax, if that's going to help strengthen my bones.
Right. Well, that's a very good question, and I'm glad you asked. Your doctor didn't tell you about the importance of it, I'm assuming? So the great thing about Fosamax is you're going to take this, and it's going to help strengthen your bones. It's going to replenish that calcium and vitamin D that you need. But if you don't take the Fosamax, then you're basically going to kind of still lose it. So think of it this way. If you've got this replenishing going into the bones, the Fosamax is going to kind of act as a little sealant. It's going to keep everything in there so you don't have anything leaking. So basically, if you put this in and you're not using the Fosamax, you're still going to lose it at as rapid of a rate as you're losing it now. But if you use the Fosamax, it's going to help kind of keep it within your body so you can continually absorb it. So does that make sense?
Yeah.
Yeah, so it's going to help you retain it. It's going to help keep it in your bones. It's going to help maintain the bone strength that you're gaining back. Okay?
Okay.
What other questions do you have? Any other things you got on your mind?
No, not that I can think of right now.
Okay. Well, here we go. Here are your medications.
Thank you.
Again, my name's Adrienne Wright. So if you have any questions, any issues, anything comes up, feel free to call up here, ask for me. I'd be happy to help. Anything I can do to help you. Here's your information sheet regarding that.
Thank you.
And you have a wonderful day, Ms. Williams. I'll see you next time.
Thanks. You too.
You too.